Continuing coverage tonight on two potentially deadly diseases. It's keeping health departments busy in Pima and Cochise counties. In Pima, it's a year-old baby with measles.
In Cochise, it's an elementary school student with mumps. As KGUN 9 on your side's Craig Smith reports, officials say both are easy to prevent with vaccinations.
Measles means much more than a case of red spots that fades in a few days. It can kill or leave someone with pneumonia, seizures, or brain damage. The Pima County case involves a 12-month-old baby. International travel figures into this case of the measles. It's believed the child was actually infected on a trip to Asia, but that does not mean it left a trail of infection from Asia all the way back here. Measles does not become infectious right after you catch it, and the child did not enter the infectious phase until it was back in Arizona. Paula Mandel is deputy director of the Pima County Health Department. She says until the spots appear, you may not know you're dealing with measles.
Symptoms of measles, typically what we see is a high fever, 101 or higher. We see red eyes, watery eyes, runny nose, cough. Those are the first symptoms. And then as it progresses, we see a rash.
In this case, the baby was not vaccinated because at 12 months it was barely old enough to be vaccinated. In Cochise County, Elfrida Elementary School used Facebook to warn parents an unvaccinated child there came down with mumps. The Arizona Health Department says mumps can lead to meningitis, deafness, or death. On KGUN 9's Facebook, a few people voiced fears about vaccine side effects. This man worried about seizures. But doctors and nurses say vaccines are safe. A strong majority on our Facebook agree. This woman remembered two diseases vaccines stamped out in the U.S. She mentioned the paralytic disease polio, saying, how many parents could stand to see the kids in an iron lung? Or smallpox? Craig Smith, KGUN 9 on your side.